Hi, welcome to Chandler in Focus. My name is Terry Rowe. I'm a councilman, and we're here to talk about the misuse of prescription drugs here in Chandler and what we're doing to fight that problem. I have two guests here. We invited two guests to talk to us, and Ted Huntington with ICAN, and he's a program manager there, and Matt Christensen, he's a commander with the Chandler Police Department. And so thank you both for coming, and so we're going to go ahead and get started. So Matt, tell us how serious of a problem is the abuse of prescription drugs here in Chandler?
The abuse of prescription drugs is a serious issue that we've got going, and we worry about the youth, but it's an across-the-board issue. There's some overprescription of prescription drugs, particularly the opioids, the painkillers. That's also what's contributing to the increase in heroin. People are using the opioids, then they get where they don't get a prescription anymore. They still have that need, and then they move on to heroin to fill that need.
Yeah.
So yes, it's an issue, and it's an issue across the board.
Serious drugs. These are not just drugs you imagine on TV. They're the real thing, and very serious. Heroin and those things are not. That's very serious stuff.
Absolutely.
So affecting Chandler on what level? Who's impacted the most?
We're impacted across the board. We see it in driving. We see it in schools. We see it in overdoses. It impacts the fire and medical a lot. What we're looking at through the coalition right now is directing it at the youth and trying to intervene on the youth level. There's also other interventions that are going on at different age groups or different levels and different approaches to the problem through medical institutions, through tracking the prescriptions themselves. We're trying to get a handle on it on a global scale. But our focus right now is trying to keep it out of the hands of kids.
One tool that I understand that we're using are a prescription drop box. And Matt, maybe you can tell us a little bit about where those are, what those are about, and share with our viewers.
Sure. When we're sitting there and we try to address the problem and try to figure out where the supply is coming from, most of the supply is coming from medicine that's been prescribed appropriately but then hasn't been used. And kids are getting it out of their parents' or grandparents' medicine cabinets and then abusing it. So what we've come up with is a program of drop boxes where you can take your prescription medicines and drop them off at all three locations that we have at the Chandler Police Department. We have the Desert Breeze substation. We have the Chandler Heights substation, which you can drop them off 8 to 5 Monday through Friday. And then we have the main police station at 250 East Chicago Street, and that's open 24 hours a day, 7 days a week. You can bring in all your pills. You can bring in anything but liquids. We don't have the ability to store and take care of liquid medicine. So there was also people, I've been asked about needles and stuff like that. If the needles are appropriately stored, if they're in a sharps container and or they've never been used before, they're still in their original container, they can be dropped off there as well.
Well, that sounds like a good idea, but I mean, are they effective? Is this something that people are really taking advantage of, for our viewers?
We're amazed as a department of how much that we're bringing in. Just to give you an idea, the drop boxes are about the size of an old style mailbox, the one that stands up. It looks like R2D2. We're filling those about once a week. And we're pulling about 130 pounds to 150 pounds of prescription meds out of it a week, because that's how we track.
That's out of one location, or is that?
That's a combination of them.
Yeah.
I think they hold about 55 to 60 pounds apiece, and we're filling them about once a week. And it's amazing how much prescription medicine is showing up in those.
So now, Ted, let's talk a little
Yes.
bit about the Chandler Coalition on Youth Substance Abuse and how what the tie-in.
Okay.
Can you provide a little brief history there?
Yeah, I can. The Chandler Coalition on Youth Substance Abuse is under the parent organization of ICAN, and ICAN's been involved in the community for over 20 years, providing after-school programming for our youth. And part of what ICAN does is they used evidence-based programming in order to help promote safe, healthy lifestyles for our youth. And part of the process of doing that is doing community surveys and needs assessments. And in 2005, 2006, there was a reoccurring it was a reoccurring attention to the fact that the community was saying that the youth substance abuse was really affecting our community, and that there was a real need to do something about that. So then ICAN started up the coalition. So then the birth of Chandler's Coalition on Youth Substance Abuse was then brought into being in about 2006. So that's the history of why it was started and when it was started. And it's continued to grow and create partnerships and empower the community into healthy lifestyles in reference to youth substance abuse since 2006.
So what's the overall vision for the coalition?
Well, the overall vision is to stamp out youth substance abuse in Chandler, is to eliminate it. That's the overall vision. And any progress that can be made along that way is a success. So the overall vision is to educate, provide prevention, education, and the coalition is created to empower the people of the community to bring about something that they feel that they want and they need. So it's to empower the youth to not only become educated themselves in what are the different substances, how are they affecting their lives, short-term, long-term, and why they shouldn't enter into this kind of high-risk behavior. Identifying some of the reasons why youth even enter into high-risk behaviors, and then allowing them to bring that to their fellow peers. So they get educated information, and they're equipped, and the coalition is designed for the youth to bring that to their peers, and the same thing with adults. That adults have a place where they can obtain the information on what is really going on, what's going on with the kids, what are the statistics of kids that are abusing alcohol, tobacco, a variety of drugs, where they're getting it, the access, how to prevent it, and tips. They get educated, and then they bring the education into the community. And when it's working in the way it's designed, then it's functioning where you not only have youth from various places, but you have adults and community leaders and everybody bringing the power to the vision of saying that this is something that we feel is not healthy for our community and it's not safe, and this is how we're going to rise up and do something about it. Be the change is one of the slogans.
Oh, good.
Be the change.
So the word coalition is it's a little narrow, because the truth is a coalition is our entire community. We are the coalition. So the coalition certainly has done some. I mean, the board and people involved have created some possible. What are some action steps?
We provide training and education to the public, and we provide classes on underage drinking, prescription drug misuse, general a class on just the general drugs that are out there right now, what is prevalent, what is new, what is being used. We also provide tips on parenting, how to recognize that if maybe a youth is experimenting or involved, tips on how to teach them how to make guided and informed decisions. We're also able to provide classes in the schools where we go into the junior highs, the high schools, and the grade schools, and kind of like an old DARE.
Like the DARE program.
I remember,
Has some of the same themes.
Some of the same themes. It's the same techniques of going in and bringing information to the students in a form where they can receive it.
Yeah.
And
so
provide
DARE,
education.
for those folks that don't know, was a drug abuse resistance education program. I'm sure many people remember that, and so this follows. We don't have that program in Chandler anymore, so we're glad to have your the coalition taking up and helping out in that area. That's terrific. So
we partner with the police department in doing party patrols where they go out and they look for active parties where there is underage drinking. We also do shoulder tapping where students will go to a facility that sells alcohol, and with the support of police and other adults, they ask adults if they would buy them alcohol, and if they say yes, they give them a card saying, the issues that the youth are facing, and the police help them combat that. And if they say no, they thank them and for helping keeping the community safe. There's the social media. Facebook is really have been effective for prevention, where we're able to put out a lot of information that's helpful in tips, parenting, what are the current drugs that are being used and abused. So the Facebook has been a very productive tool. We have a website that provides this information. In getting the downtown community involved and the businesses, there's businesses that put up posters that will talk about these things, and there's also stickering that they do. So there's different ways and a number of ways that we can. If you want more information, you can definitely go to our website or call or find out. We can give you a list of how the community can get involved in some of these.
The coalition is obviously doing a lot, and so Matt, what a couple of quick tips, because we're running low on time, but maybe you can share with our viewers what parents might be able to recognize as far as help prevent or detect substance abuse in their youth or their children.
I'd be glad to. The first thing that I've learned over my career is that parents need to have a discussion with their kids and talk openly about drugs, drug abuse, and be aware of what the current drugs are that are out there. It's not the same as when we were in high school, those many years ago. There's stuff on the street now that unless you know what you're looking at, you wouldn't even know that it's drugs. So the parents have to educate themselves, and they have to have the discussion with the kids. The other thing that I'd recommend is that there's a program that we're working on through CCYSA, and as opposed to the drop box, this is a lock box. It is if you have opioids prescriptions in your house, or any other prescriptions that are liable to be abused, you can get a lock box that fits in your medicine cabinet. It sticks with industrial tape, and you can actually lock your prescriptions up to keep people from getting them and abusing them. Those would be a couple of hints that I would run towards.
Well, those are good hints. So obviously, the Chandler Police Department has an interest in youth substance abuse and trying to stop that. And very quickly, what is what is Chandler's role in the CCYSA?
As far as the CCYSA, we've been on the board in the coalition since it was founded. I think the last 3 presidents have all been members of the police department. We're very supportive of the coalition. We work very closely with the coalition. The party patrols and the shoulder tapping are all done in conjunction with the police department. It's a very good grassroots organization that helps us do our job in curtailing alcohol abuse and substance abuse by children. In
an educational way, informative way, and empowering folks, not necessarily in a punitive way, and so that's a great thing. It's
Right.
good to it's great to hear.
Absolutely, that's
Yeah.
the major turn, and the other part is the kids are involved in it. When we have the meetings with the board, I mean that it's kind of funny. The board members, that there's like will be 6 of us, and there'll be 25 kids in there, and they're all excited about getting the message out about substance abuse and how not to become entrapped in it.
Any final words there, Ted?
Well, we are going to be able to unroll an initiative, an RX misuse and abuse initiative that's actually also being supported by state government, by county, and our city. We're going to combine different sectors, 5 different sectors, in an approach to really take this next year and focus on dramatically reducing the misuse and abuse of RX prescription drugs. So we'll be able to roll out more information on how we're going to do that as this year progresses, and there'll be a lot of ways for people to get involved and to garner information and to really be able to understand what is going on and how to roll out the prevention for it.
Well, those are some good final words. And I want to thank you both for coming here and talking about CCYSA, talking about prescription drug abuse, and the very real problem that it is here in Chandler. But it's not a problem that we can't work to address, and that's exactly what your goal is, and
Yes.
We appreciate that. Thank you all for watching. This is Chandler in Focus. I'm Councilman Terry Rowe, and we'll see you next time.
Booze,
Brewski,
liquor,
Sauce. Hooch. Hard stuff.
juice,
Cocktails.
Spirits.
Rod cut. Sir? Yeah. Buy me a beer for $30?
Whatever words are used, don't buy alcohol for kids. Take pride in preventing underage drinking. Be the change.